Hello, everybody, and welcome. We'll get started in about 45 seconds. My name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy. And so I will reintroduce myself in 45 seconds. All right, so hello everybody and welcome. Welcome to Florida Training Academy. My name is Eunice Mathis. I'm a registered nurse and I will be your nurse instructor this evening. We're going to review 25 multiple choice questions that focus on safety and emergencies as it relates to being a certified nursing assistant. And so we're going to give it a few more minutes. Right now we have 8 people who have joined in. Hello, Marie. Hello, Sandrine. And then I think it was also Elise. Hello, good evening, everybody. Hey, Kador. All right, so we're going to give people a few more seconds before we begin. And thank you all for joining us for our Monday Night Live. I know you all could be watching football right now, but you chose to study for a few minutes. So I appreciate you. All right, we're going to be starting in 15 seconds. Hello, Nadine. Welcome. You'll have fun. All right, so we're going to go ahead and get started. If you would, please. My name is Eunice Mathis. I'm a registered nurse out of Jacksonville, Florida. The practice nurse assistant exam is good for the entire state, actually for the entire nation. What I'm teaching you is just basic information, basic in the chat. Let me know where you're viewing from, and we're going to begin. I'll check the chat box in a few minutes. So number 1, you're in your hospital. Dietary deliver trays to the patients at mealtime. What is your role as a CNA at mealtime? A, clear the overbed table, clean and wash the patient with proper mouth care before trays are served. B, wash the patient's face and hands. C, you only have responsibility if the patient needs to be fed. D, you have no role as the dietary person will take care of the patient. We'll give you about 5 seconds. What do you think the response is? Go ahead and put it in the chat. All right, 3 seconds, 2 and 1. Any answers? The answer for this is A. Great job, Marie. It is A. We need to clear the overbed table, clean and wash the patient. And so mainly we're talking about their hand hygiene. Remember, you do want to take care of this patient's hands, especially whether you're feeding them or not, because they may have been scratching or touching things and you don't want them to contaminate their food. What position do you need to put this person in? Whether or not they can feed themselves is not the concern right now. We want to make sure we keep these patients safe. So what is the position we use whenever we are feeding a patient? Does anyone know? And if you don't know the name of the position, how high do we raise the bed? All right, so I put it in the chat myself. It is called the Fowler's position. So whenever you're feeding someone, you want them upright. And so we call it the high Fowler's position. And the reason why I am still talking about this in addition to answering this question, because dietary is just going to put the tray there. It is your job as a CNA to make sure this patient's safe and make sure they have the actual tray that they're supposed to have. We don't want a diabetic patient having a tray that has sugary items on them. So you're going to get into that room. You're going to make sure that patient is sitting upright in the Fowler's position. Make sure they have their dentures in. Make sure their hands are clean. And then watch them take a bite. And if they can take a bite safely, you can leave them and go to the next resident. All right. Hey, Evelyn from Jacksonville. Hopefully I can meet you one day. Yes, Marie and Kador, it is Fowler's. Number 2, how can the CNA best avoid skin shear when moving a resident up in bed? A, make sure the resident is dressed. B, make sure the resident's skin is damp. C, make sure you use a draw sheet and obtain assistance. D, make sure you use a mechanical lift. You're moving a patient up in bed. How do you avoid skin shear? We'll reveal the answer in three, two, one. Sandrine, you are correct. It is C. Very good. Very good, Maureen. Good job, Marie. It is C. A draw sheet is like a folded sheet that we'll put beneath a patient. And instead of pulling on the patient where their skin is rubbing on the bed, it'll be a team of two, one CNA or caregiver on either side of the bed. We lift the sheet, which then lifts the patient. And that's how we can move them up without tearing or dragging their skin along the bed. You would not need a mechanical lift to scoop someone up in bed. You use a mechanical lift when you're taking them out of the bed. Great job, everybody. Number 3, Mrs. Johnson has refused her bed bath for 2 days. What might help to convince her to accept the bath? A, tell her gently that she smells. B, ask her why she's refusing her bath. C, suggest that her family would not like her refusing her bath. Or D, tell her she will get in trouble if she continues to refuse. All right, so what do you think? We'll reveal the answer in 3, 2, and 1. I don't see any answers yet. Let's see. Did Paula just say C? I know Paula didn't say C. Yes, Sandrine and Kador, I see the answers now. The answer is B. Find out the person's why. Maybe she doesn't want a bath right now because her favorite TV show is on. So the explanation is empower the resident to define the problem and show her how to fix it. Be extra attentive to water temperature and air temperature, privacy and pain, as these may be reasons patients refuse to bath. And I want you to think, as a caregiver, sometimes your patients don't have body odor at all, but we need you to give that bath so that we can actually get a true assessment of their skin. There could be a developing pressure sore, so those skin assessments are important. And your nurse can only do so much. So if you're in there and you can give that bath and you notice something, let your nurse know. If something doesn't appear the normal skin tone, you're going to hear the term redness a lot, especially when we're talking about bed sore prevention. But those who are browner skin tones don't turn red. So if there's a discoloration, if there is a gray area, if there's an area that just doesn't look the same as the others, notify your nurse, because that could be the sign of a pressure sore of somebody who's a dark-skinned Asian, Hispanic, or an African-American client or patient. Number 4, an angry resident is threatening to hit another resident. What action should be taken immediately? A, explain to the resident he can be discharged from a facility if he hits the resident. B, separate the residents. C, ask the resident why he is angry. D, ask the other resident what he did to make the resident angry. I need you to protect your residents. So what do you do? Good night, Vivette. How do we protect our residents? Revealing the answer in 3, 2, and 1. Yes, Mila, it is B. You're going to separate the residents. So, in a crisis situation, preventing injury is the priority. Once the residents have been separated and the danger of injury is past, staff can discuss the situation with the residents and provide counseling on the behavior. And separating them could also mean changing their room assignments. We don't want a violent person in a room with someone and they can injure them. So make sure your nurse is made aware so we can change the bed assignment if necessary. Number 5, hospitals, nursing homes, and other healthcare settings are at risk of workplace violence because A, most employees hate their jobs and their work. B, most patients and residents are angry at staff. C, these settings do not have armed security. And D is hard to see for some reason. These settings allow strangers to enter at all hours. I want to reread D. These settings allow strangers to enter at all hours. Okay. Why do you think hospitals, nursing homes, and other healthcare settings are at risk of workplace violence? Revealing the answer in 3, 2, and 1. Any takers? It's D. So I want you to think about those emergency departments. What a lot of you all don't know is that healthcare providers, we're one of the most abused set of professionals because we don't have guns. We don't tase our patients. Our patients and their family members come in violent, especially if they've been on drugs or if they're really confused due to an illness, and we have to try to console and treat them. We cannot cause them any harm. So these settings allow strangers to enter at all hours, which could be the family members. It could have been an abusive husband. And that's why your hospitals, nursing homes, and healthcare settings are at greater risk for workplace violence than other places. A lot of them will have armed security. So if something were to happen, you go ahead and you press that emergency button, you call for help, and then the other staffer should come in to assist you. And then whoever's at the desk will more than likely call security, and security can come in and remove people if necessary. Number 6, you are assigned to help residents in the group dining room during their lunchtime meal. Or residents begin yelling and they throw a spoon at you. Your best response is to do which of the following? A, remain calm and ask the resident what is upsetting them. B, remove all of the other residents from the dining room. C, scold the resident and tell the resident to leave the room. D, take the resident's fork and plate so there's nothing else to throw. If you choose D, you got close enough to get stabbed with a fork. Just think about that. So the answer is not D. Give me another answer. Yes, Celeste, it is A. You want to remain calm and ask the resident what is upsetting them without upsetting the other residents. So you're going to remain calm, and you are going to attempt to find out what has triggered this resident's anger and poor behavior. There is no need to remove the other residents, and we should never scold a resident. So just try to stay calm, be at a safe distance, and try to find out what caused the person to act out. Number 7 is a long one. Let's see if I can read it without without messing it up. You enter your resident's room and she asks you who the new nurses are. She is able to describe them to you and states that they came to pack some of her belongings for safekeeping. She seems upset by this. What is your appropriate action? A, do nothing, as this patient is having a delusion. B, tell the charge nurse what the resident said and ask if there are new staff who may have packed up her items. C, go looking for the new staff to check out the resident's story. D, immediately take the resident with you to try to identify the staff and ask why they have her belongings. What do you think the best response is? Hi, John from Kenya. We'll reveal the answer. Yes, Mila, it is B. Great job. Revealing the answer right now, everybody. So you're going to tell the charge nurse, report the resident's observation to the charge nurse and ask if these are authorized persons and activities. If all of this is okay, she can tell you. But if there are intruders or thieves, she can notify the supervisor and security. So I know that you don't think about people coming in and out of hospitals, but not only do they take patient items, they also take the staff items. They steal purses and everything. So if the patient says something and it seems suspicious, please go ahead and follow up. Yes, it's best to tell the nurse, Mila, but there are going to be some instances and a few questions where telling the nurse isn't an option. All right, so number 8, Mr. Sweet is an alert and oriented diabetic resident. He bathes and dresses himself with minimum assistance. What part of his body should the CNA inspect daily? A, his face, B, his hands, C, his genitalia or his private area, or D, his feet. All right, so what do you think? We have John, Evelyn, Stella, Marie, Nadine, Mila. It's a lot of you all tonight. Kadora, Lena, Vitalia, Celette, Marie. Any takers? Yes, Mila. Yes, Renee. It is D, the feet. Because diabetics have poor circulation. And so they commonly have neuropathy, which results in decreased sensation in the feet. So even though he can take care of himself, if he gets a wound on his foot, he can't feel it. There's a story here locally in Jacksonville where somebody didn't even know they had diabetes until they got an infection that caused their leg to be amputated. So we want to make sure, and the leg was amputated because they had a foot infection that they didn't know about. So we need you to be checking their feet and making sure they have proper shoes on. Diabetics should not be wearing flip-flops. Number 9, you are caring for a resident who is hallucinating and seeing spiders on the wall. She points them out to you and she wants you to kill them. What should you do? A, show her the spot on the wall and explain that it's just a spot. Reassure her that if you find any spiders that you will take care of them. B, take a shoe and hit the spot and tell her the spider is dead. C, give the resident a fly swatter to give her a sense of security. D, ignore the patient's request in order to not reinforce the delusion. You have a patient who's hallucinating. What should you do? Yes, John. Great job, Hamdi. Great job. Yes, everybody. It is A as in apple. So it is best to confront the hallucination in this case, but reassure her that if there were any spirals, you would take care of it. Sometimes you all, our confused patients have a moment of clarity. So you don't want to just, downplay what they're saying, but actually go look to see if there's somebody in the closet, go look to see if that spot on the wall is actually a spider. And then, you can always reassure them, and you can a report should be made to the nurse about the issue. Let's say if there were bugs, so we can get the environmental services in there to clean it up. Oh, this one's hard. I got this one wrong, you all. All right, let's see if you're smarter than a nurse tonight. 10, if you see a resident holding his throat, what is your first step? A, ask the resident if he or she is choking. B, perform abdominal thrust. C, call for help. D, encourage the resident to drink water. I know half of you all smarter than me because I can't believe I got this one wrong. Renee's smarter than me. Great job, Renee. Yes. Oh my God. You all are embarrassing me. So I, for some reason, chose C, which is absolutely wrong. The answer is A. The person may not be choking. They could just be holding their throat. But the first step when a resident is holding their throat is to call. This one says to call for help immediately, but you want to ask the person if they're choking because they might not be choking at all. So you all are correct, even though the explanation there isn't as right as I'd like it to be. Number 11, you observe a patient hemorrhaging. What is your intervention? And if you don't know what hemorrhaging is, that is a large amount of blood. So there is bleeding and then there are huge volumes. That would be hemorrhaging, okay? What do? Do you apply pain medication, which is A? B, do you apply direct pressure to the wound? C, do you elevate the affected limb? Or D, do you offer the patient a drink of water, which has nothing to do with bleeding control? How do you help a person who's hemorrhaging? Yes, John, it is B. Jessula is B, mylocator. Great job, everybody. You apply direct pressure to the wound. And we do have a video on how to manage stop the bleed. So if somebody was shot by a gun or something, how to apply direct pressure. So that is in one of our playlists. But you're going to have to apply pressure if the person is starting to lose consciousness, or if there's a large volume of blood. You can apply a tourniquet or a makeshift tourniquet, but you're going to have to keep holding pressure until the ambulance arrives. So yes, the first intervention when a patient is hemorrhaging is to apply direct pressure to the bleeding site. This can help to stop or slow the bleeding until further medical attention can be obtained. Great job, everybody. Number 12, Mr. King has an order for a vest restraint. Oh, he was misbehaving when he's in bed. How will you secure the restraint to keep the resident safe? A, are you going to tie it in a slip knot and attach it to the bed frame? B, will it be tied in a double knot to the bed frame? C, will it be tied in a slip knot to the side rail? Or D, will it be tied in a double knot to the side rail? If you don't know what a slip knot is, it's pretty much the way you tie your shoes, where if you pull one string, it easily releases. So how would you put this restraint vest on Mr. King? Where would you attach it? We'll reveal the answer in 3, 2, 1. Renee has it. John passed it. Marie is not C, but you were close. We don't attach anything to a side rail. So you all knew it was a slip knot, but the bed frame, the actual frame that the bed sits on, it has little holes or it has little hooks. And you can attach the drainage bags, you can attach the chest tube, you can attach your restraint in those little holes or those loops, those hooks. And the reason why we use a slip knot is in case of an emergency. If there's an emergency, you just pull one string and the entire restraint comes loose so that you can rescue your patient. We never attach anything to a side rail because a side rail can appear to be in place. And as soon as you touch it a little bit with your leg, it can fall and it can collapse. So if the patient's tied to it, you can actually dislocate their extremity, or if their catheter is attached to it, you can pull on a really sensitive area and no one's going to like you. So we don't attach anything to a side rail, bed frame only. Great job. I see you there, Renee. 13, the primary reason that people act out with disturbed behavior in a healthcare facility like a nursing home is because the person has a problem with blank. A social problem, B, a spousal problem, C, a cognitive problem, or D, a physical problem. When these patients are trying to hit you, what type of problem do they usually have? Yes, Mila. Yes, Jeshua. It is C. They have a cognitive problem. And so the primary reason that people act out with disturbed behavior in a healthcare setting like a nursing home is because of a cognitive problem like dementia or Alzheimer's disease. Signs of cognitive impairment include memory loss, mood swings, and behavioral changes. So great job, everybody. If you didn't know what cognitive means, add that to your terminology. Great job, Stella. Number 14, Mr. Long ate very little breakfast today. Which of the following diagnoses would require that this information be reported promptly to the nurse? A, congestive heart failure, B, morbid obesity, C, dementia, or D, diabetes? He didn't eat enough breakfast, but he has blank disease. You need to notify your nurse. Which disease is it? All right. We'll reveal the answer. I know I don't give you much time. In 3, 2, and 1. All right, so Mila said D, Vivette said D, John, it is D, diabetes. And so whenever someone has diabetes, any change in their intake should be reported. The residents with diabetes, if they don't eat food, the medications that we give them to control their diabetes work around the clock. So if they're on insulin or an oral anti-diabetic agent, we have to make sure they have their meals on time. Otherwise, their blood sugars are going to drop. Something else that once you're in the facility, they will teach you how to do is how to check the blood glucose. The machines are called glucometers. You would be checking the person's blood glucose levels before meals and at bedtime. I have no chocolate, no gifts to give you, but can someone in the chat tell me, why do we check a diabetic's patient sugar level before they go to bed? So yes, we want to make sure they're eating their meals, but I need my CNAs to make sure they check the sugars before bedtime. Why? Let's see if someone can beat me typing it before I type it. I told you all that the medicines work around the clock, so what might happen during this person's sleep hours? All right, so with your diet, yes, yes. The blood sugars may drop while they're sleeping. So we always do a blood sugar on our in our hospitals on our diabetic patients before they go to bed. We want to make sure that their sugars are at a normal level, and you'll find out what those normal levels are when you're in your facilities. But for most places, we want that blood sugar to be greater than 80 but less than 150. So between 80 and 150, but it varies based upon the location and the patient. Next question. You all are doing so great. Number 15, your resident has received a new radio and his family has stretched the electrical cord across the room and plugged it in. What should you do first? A, unplug the radio and explain the danger to the resident and the family. B, look for a better place to plug the radio in. C, remove the radio and take it to maintenance for a safety check. D, ask the family to take the radio home so it will not get broken. What do you think? I'm revealing the answer in 3, 2, 1. Vivette said A. Renee and Kador said B. Marie said B. It's going to be A. I know it's pretty much the same answer, but yes, you have to unplug it first, but explain to the family because if you just go take it somewhere else and plug it in somewhere else, because the family wasn't even aware of the hazard, they just may take it out, replug it back in, and stretch this dangerous cord across the floor again. So, first, try to neutralize the tripping possibility and explain this to the family. After this step, you can find a better plug site and get clearance from maintenance. So A is the priority, and you can do B, C, and D afterwards, but get rid of the hazard right away. Number 16, you see a cup of medication sitting on the bed, you see a cup of medication sitting on the table in the dining room. What should you do first? A, ask the resident if they took their medications. B, check the medication orders to determine which medications are missing. C, notify the charge nurse or the physician. D, remove the medications from the table. There are medications sitting on the table. One of these nurses forgot. What do you do? Yes, Vivette, Renee, it is D. Remove the medications. And so, for those of you all who said it's your first time tuning in with us, we usually have practice questions 3 or 4 times per week. And we have a playlist with hundreds of practice CNA questions. So, there's no reason for you to fail this test. So, we thank you for tuning in. Please like this video, subscribe to our channel. And here's the explanation for number 16. Anyone who said D, you are correct. The first step when medications are found unattended is to remove them to ensure that other residents don't accidentally take them. After the medications are removed, the nurse or other staff members can take further steps to determine which medications are missing and ensure that the residents receive the correct dosages. So great job, everybody. Let's see number 17. All hospitals and nursing homes are mandated to have a goal of a restraint-free environment. The best way to receive this goal is to blank. A, ban the use of all restraints under all circumstances. It's not A because when those patients come in sometimes they are violent. So it is not A. B, limit restraint use to only those situations when falls cannot be prevented. C, keep all bedside rails up for all patients during the nighttime hours. D, use non-skid or no-skid socks and sheets to prevent falls from chairs. D has nothing to do with restraints. So we know it's not A and it's not D. So what is the answer? Nadine, did you say C? I'm revealing the answer. All right, a lot of B's in three, two, and one. It is B, everybody. Great job. We're going to limit the restraints to only those situations when falls cannot be prevented. Let me tell you the reason why it's not D. Anytime you put up more than two side rails, you need a doctor's order for that. So two side rails are customary. When you put three side rails up, it becomes a restraint. Four side rails is definitely a restraint. Or what we also like to do to try to be slick is we'll put that bedside table over the resident and put three side rails up, and the side rail that's down, we just put the bedside table over them. Technically, we have restrained this patient without a doctor's order. And so in order to be restraint free, your patient must be able to move. Okay. So if they don't have an order to be restrained, you cannot have three side rails up, just FYI. Okay. And a way to reduce the restraints is sometimes your facilities will hire a sitter, and the sitter will sit at the bedside with your resident. If the resident starts moving too much, that person will alert the nursing team so the nursing team can get that person back in bed. And we also have bed alarms. Number 18. What is your first step when you find a resident not breathing and without a pulse? A, administer chest compressions. B, call for help. C, check for a carotid pulse. D, administer rescue breaths. Your person is not breathing and they don't have a pulse. What do you do? Kiki, I'm not sure why the screen looks blurry. I hope you can see it better now. Everyone's saying they can't see well. Has the screen improved? Great job, everybody. It is B. You want to call for help. And after you call for help, then yes, for that, you can start those chest compressions. So call for help because we need those advanced providers there. We need the nurses. We need the whole rapid response team because you don't want to be in the room alone with someone trying to manage all of that care. So make sure you call your team. And of course, we're going to start CPR. 19, the majority of incidents in long-term care settings are from A, medication errors, B, elopement. That means your patient's escaping, going out a door they should not be going out of, C, falls, or D, abuse. The majority of incidents in long-term care settings are from, what do you think? Yes, why it is C. Correct, correct, correct. It is C. It is falls, you all. So, how do we prevent our residents from falling? So, falls in the elderly are the leading cause of disability and death because many factors can contribute to falls. When that person calls you to go to the bathroom, I don't need you walking slow. I need you getting there as fast as possible because some of these elderly people will try to get up without your help. And no, they cannot stand up with church socks on. If they have on those trouser socks and they try to stand up, they're just going to slip and fall. So they should always have on the proper socks, which would be the non-skid socks or shoes. And if your facility uses gait belts, you should be walking them to the restroom with a gait belt. That is how you're going to prevent a fall. And if little old Eunice is just super stubborn, don't get me up by yourself. Because if I fall, I could hurt you. Don't be afraid to call for help. Number 20, you suspect that a resident is having a seizure. So they're having convulsions, they're shaking, they're either in the bed or on the ground. What is your first step? A, try to restrain the resident to prevent injury. B, place a tongue depressor in the resident's mouth. C, time the duration of the seizure. D, clear the area around the resident to prevent injury. Nadine and Jessula, give me a different answer. Church socks. Yes, Renee, church socks. Nadine and Joshua, yes, everybody, it is D. We want to clear the area. Of course, you're going to call for the nurse, but that wasn't one of the options because this person's thrashing about or their head could be bouncing and hitting on the floor. So we need to clear the scene. We don't want them hitting chairs. If their head is hitting the floor, you can put a pillow, a towel, a purse, a coat, put something under their head. Do not try to stop their seizure. Once you have everything cleared, of course, you've called for help, then you can try to figure out the time. But the first priority is to make sure that person, while they're seizing, is as safe as possible. And you don't put anything in their mouth. That's an old myth. They're not going to swallow their tongue and they're not going to bite their tongue off. Actually, when you stick something in their mouth, you cause more injury because they're seizing and you're trying to hold their tongue down with a tongue depressor. So you are actually causing injury to the person at that point. Number 21, which is most likely capable of a nursing home? B, a double agent who is spying on a group of residents. C, a former staff member who has been fired. Ding, ding, ding. D, people that are in opposition of Medicare and Medicaid. Yes, Marie, you're correct. Move the furniture to prevent injury. But now we're on number 21. Who's the most capable of workplace violence? Revealing the answer in 3, 2. John, you're right. 1, it is C, a former staff member who's been fired. You all, if Lucas got fired from his job and you see him on your unit, I need you to be on high alert. Because he may be disgruntled and he may be there to, seek revenge. So when someone who was fired returns to the job, you want to be very careful. Okay. Make sure you look out for others and look out for your patients. Number 22, residents in long-term care facilities are at risk of injuries because A, they have limited mobility, B, because they may be confused or disoriented, C, they may have visual or hearing impairments, or D, all of the above. Renee, I'm not with you tonight. All right, so why are they at risk of incidents, everybody? Why do you have to be so careful with your elderly residents who are in these long-term facilities? Revealing the answer in 3, 2, and 1. Yes, D. D was right. Nursing home residents typically have multiple impairments or limitations that impact safely. Keeping residents safe from unnecessary accidents and incidents is the goal of nursing home care. I'm so proud of you all. We're almost done. I tell you, when I get off of these lives, I miss y'all. I think I need a life, as if I don't do enough during the daytime. I teach during the day and I come in at night and I spend time with you all and you spend time with me. So anyway, I appreciate you. Number 23, you are new on the unit. Many residents on the unit are ambulatory. Ambulatory means that they can get up and they can walk. Your assignment is to give Mrs. Jones in room 306A a bath. There is a resident sitting on the bed in room 306A. She is not wearing a name bracelet. How will you make sure that this is Mrs. Jones? A, ask the resident if she is Mrs. Jones. B, ask another resident to confirm that this is Mrs. Jones. C, ask another staff member to confirm Mrs. Jones' identity. Or D, ask the resident to state her room number. Skipper, I'm happy this is fun. How do you know if this is Mrs. Jones or not? Rosina, the screen is still acting up. Some people can see, so I'm not sure what it is. I apologize. Yes, it is C. Hi, Mashu. It is C. It's not A, everybody. Don't ask the resident if she is Miss Jones, because confused people will say yes to everything or they will say no to everything. So it's best, especially if they don't have a bracelet on. Sometimes the charts will have an image of the person, but otherwise, ask another staff member who's aware of the residents. Just don't go up and ask a resident if their name is Mr. or Mrs. Such and such, because a confused person will say yes, and you'll be providing the care on the wrong patient. Okay, so that's a safety hazard. Yes, you must be documented. All right, 24. After rescuing the residents, what is the next step to take during a fire? A, activate the fire alarm. B, evacuate the building. C, try to extinguish the fire. D, notify the charge nurse or supervisor. So you've rescued the residents. What do you do next? There's a fire in the building. Yes, John, you are correct. It is B. Everybody, you are correct. I went ahead and I put the acronym here. And the acronym, anytime there's a fire in your facilities, you want to race. The difference is with the statement or the question that we just read was that you already rescued all the residents. So you're not going to go back in. This one is the acronym that you want to remember is RACE, which stands for rescue, alert, or alarm, meaning that you're either going to pull that fire alarm or you're going to be calling 911 to get the fire department there. C, you're going to confine. Your hospitals and your nursing homes have these huge wooden doors. They are fire rated doors. You want to close the door so the fire can't come through and down the hall. Or into a patient's room. And then the final step is extinguish or exit. And so after rescuing residents in immediate danger and you've already activated the alarm, make sure that you save yourselves and save others and evacuate that building. So it could be either or. It could be A, or it could be, let's see what the other one was. A, or for me, A or B would be accurate because you've already rescued the residents. So that one has a discrepancy. I apologize. And our final question of this evening is 25. What can sensory changes, or what should be, maybe it's, what can sensory changes in older adults cause? A, increased sensitivity to pain. B, decreased perception of temperature. C, increased ability to taste bitter flavors. Or B, increased sense of hearing in high frequencies. So what would be a sensory change as we age? Hi, Shalene. Hi, Denise. Latoya, hi. You say A. All right, I'm revealing the answer in 3, 2, and 1. So everybody, as we get older, we have a decreased perception of temperature. So sensory changes in older adults can cause from a variety of issues, including, we talked about the temperature, but this can put a patient at risk for burns or hypothermia, which means they can get cold really quickly, and that can cause injury to their skin because they're unable to accurately sense the temperature of their environment. And so why is that a safety concern? Whenever you're giving them a bath, you're going to check the water temperature first, but you're always going to let your residents check the water temperature because they don't do well with temperature extremes. So yes, everybody, I am so proud of you. We did it. We did another 25 practice questions. Our next live is going to be on Thursday, but I will try to put out another video on Thursday and Friday, even if they are not live. So you'll have 2 more videos this week. If you can, in the comments, please let me know your next topic. I know on Thursday we're going to be doing I think it is, let me tell you what it's going to be. It's going to be infection control on Thursday. And I think on Friday, I may do another video on CPR. But do you have any ideas or suggestions? What's the next video you'd like to see? You all are so welcome. I appreciate you also. So infection control will be Thursday, and I'll probably post that Thursday. And too, hey, Latoya, I would love you to tune in on Thursday. All right, so if you all don't have any video topics or any suggestions, John, thank you so much. God bless you also. I look forward to seeing you all on Thursday. You're my babies. I keep you all in my prayers. And I'll be posting the next video or the live dates in our community post. So I'll be signing off in 3, 2, 1. Thank you all for attending our Monday Night Live. It's Nurse Eunice saying bye.